axilla, the anterior axillary fold formed by the pectoralis major muscle, anterior axillary fold. Along the anterior axillary fold up to the fourth costal cartilage, then to the table, and along the anterior axillary fold up to the upper 1/4 and lower 3/4 junction of the arm. Then the incision is up to the table. So these two are the incision. One is along the anterior axillary fold up to the fourth costal cartilage, then from that point fourth costal cartilage to the table, and along the anterior axillary fold up to the junction of upper 1/4 and lower 3/4 junction, then to the table. Skin laterally and below reflected. Now deep fascia, superficial fascia, deep fascia here, and this is the axilla. Axilla is a pyramidal structure, has got an apex, base, medial wall, lateral wall, anterior wall and posterior wall. Again, axilla is a pyramidal structure. This is the base, this is the apex, lateral wall, narrowest wall, this is the medial wall, broadest wall, anterior wall and posterior wall. In the anterior wall we find the pectoralis major muscle, Here is the pectoralis major muscle, and pectoralis minor muscle. This is the posterior wall. This muscle, bulky muscle, is the subscapularis muscle. Then here two muscles. This is the latissimus dorsi and this is teres major muscle. So teres major, latissimus dorsi up to this latissimus dorsi, teres major, and this is subscapularis muscle. So anterior wall formed by pectoralis major minor, posterior wall by subscapularis muscle, teres major muscle and latissimus dorsi muscle. On the posterior wall we find this is the nerve to latissimus dorsi, and here it is the upper subscapular nerve and this is the lower subscapular nerve. After supplying the lower part of the subscapularis muscle, supplying the teres major muscle. Here only we can see nerve to latissimus dorsi, who supplies the latissimus dorsi muscle. So this is the posterior wall. And this is the subscapularis vessels. Now this is the medial wall, broadest wall. We find this is the long thoracic nerve, segmental supply, long thoracic nerve. Here we can find the lateral thoracic artery, and this is the nerve to latissimus nerve to serratus anterior or long thoracic nerve. So these are the serratus anterior muscles and intercostal space, upper 4 intercostal space.